As this election count has gone on, the conversation and headlines around COVID have receded, but the cases have not. How concerned are you? You've talked about this potential. Is this better or worse than where you thought we'd be right now?
Well, probably a little worse, and I think that it's really concerning. We're right at a tipping point. It's not just the number of cases that are being diagnosed, but we need to look at hospitalizations, which are growing very quickly across the whole country. 53,000 patients currently hospitalized, 10,500 in the ICU. And we talk about protecting the elderly and the nursing homes, and that being the sort of basis for the entire federal strategy right now. 20,000 people in nursing homes were infected last week, and 2,000 died. So we're not doing that either. So this is a deeply concerning trend underway right now. It's going to continue for a number of weeks, and I think what you're going to see is more states take targeted mitigation steps, like what you saw in my home state yesterday, where they're closing restaurants at 9:30. They're going to suspend high school sports and take other targeted steps to try to preserve schools, keep schools open, and try to get some backstop against the spread. And here in the state of Connecticut, we're actually doing better than most states. I mean, if you look at states like North Dakota and South Dakota, they're in a really grim situation right now.
Right. Want to just ask you actually about the impact of Election Day itself and those who voted in person. There have been sporadic reports, one actually in the Hamptons recently, suggesting that there was an outbreak in one of the voting locations there. Clearly that took place on Tuesday, meaning people were there on Tuesday. You often don't see the impact of these things for several days, if not longer. Are you expecting anything in terms of an increase in COVID cases as a result of voting?
Potentially. I mean, we brought a lot of people together for an indoor activity. There was a report of someone working in a poll worker in one location in the Midwest who was infected while they were working in the poll. So you're going to see some sporadic reports like that, but I don't think that the voting was a super spreading event, if you will, simply because we were taking a lot of precautions. People were very conscious. There was a lot of things going on inside those polling stations. People were being sequenced. They were wearing masks. They were cleaning down surfaces. So I think the risk was lower just because we were aware of the risks and taking a lot of precautions inside these polling stations.
We keep having conversations about the potential for lockdowns. We're watching what's happening in Europe. You're seeing what certain states are doing. But then there's the conversation about just the psychological impact on the consumer and whether you think the consumer effectively, I don't know if we should call them consumers or just citizens, decide on their own to stay home as these cases rise. Have we seen any discernible effect there or no?
We have. I mean, and that's exactly what's going to happen. We're not going to see broad-based stay-at-home orders. Mind you, we never did lockdowns. We had some stay-at-home orders early in the spring. We're not going to revisit that, in part because we know where the virus is spreading now. We have good testing in place, so we could target our measures much more precisely. So I think you're going to see some cities, some states adopt some more restrictive measures, but it's going to be on a rolling basis as the epidemic gets dense in those regions. But what you are seeing is Google mobility data start to decline. I put out this data last week. I'm going to put it out again this week. You're starting to see the mobility trends decline nationally. And certainly when you segregate out the Midwest, the states that are epidemic, the Great Lakes region, you're seeing it decline more sharply. So what happens is the consumer really leads the policy action. You're going to see people pull back, and then policymakers are going to try to fit a framework around that.
Shepard Smith here. Thanks for watching CNBC on YouTube.